This is called ThermiTight of the lower face and neck. We're also going to use barbed sutures that are absorbable as a scaffolding to get the skin ready so we don't have to have it shrink up around it. So we'll be in position, you'll have pretty much an instant result, and really the only thing, your preparation afterwards is going to be 24 hours of compression, and then at night for 2 to 3 weeks. The next step is I'm going to mark your nerve because we're going to try to avoid it as much as possible. Not that it would do any harm, but it would sometimes weaken that nerve temporarily. First we will map the nerve on the left side by stimulating it, and then on the right side. We're ready and we're going to the operating room. First we prepare the face, and then we inject and numb up the 3 areas that we're going to introduce the probes with. We use the local anesthetic and a blunt cannula so that we minimize any bruising. The second area is in the chin crease, where we do the suctioning from to get rid of any excess fat. Now we introduce the radiofrequency probe, and the temperature is monitored on the screen to try to reach 45 degrees Celsius, which is the ideal temperature for shrinking of the skin or skin tightening. After that is done, the barbed sutures are administered through the same punctures that we did the suctioning and radiofrequency, so that we can tighten the skin using the barbs as a scaffold. This is a bidirectional suture, so both ends are introduced and anchor on themselves. First in one direction, and then the needle is placed back in the opposite direction to introduce the other end of the suture. These are then tightened by cocking the skin back on these barbs, which will help with the shrinking process and give us the immediate results. They're not cut until the other side is also finished. Upon finishing of the placement of the barbed sutures, they're cut just underneath the skin so they do not protrude or poke through. Application of the foam dressing for 24 hours and then nightly for 2 weeks is all the care that the patient has afterwards.